with all protocols observed, I would love to welcome Miss Mary Muthuni Muriki. Madam PS, very welcome. We are very honored to have you today. And from Africa CDC, we can see there Dr. Lucy Mazaba. Thank you so much, ma'am, for coming, and congratulations once again. Thank you. And from WHO, we are honored to have Dr. Adiele Onyezi, the country representative for Kenya. It's a proper Pan-Africanist representation. We have Kenya, we have Zambia, and we have Nigeria, and you have Egypt in here, if you didn't tell from the accent. So I'm called Dr. Mary Musa. I'm head of consulting at AHB. I'm the youngest, not the youngest in terms of age, but the newest member in the AHB family. I'm very proud to be here with all of you. I'm originally from Egypt, a medical doctor. I have been residing and practicing in East Africa for the last 9 years, between Uganda, Tanzania, Kenya, Burundi, and also West Africa and Burkina Faso. So very nice to have you all as we all work for the same, I think, vision and mission. Again, Pan-Africanist myself, so I'm very proud to be amongst you. Allow me to welcome Ms. Marlus Kibacha, our MD, our first leader, and yeah, thank you.
Welcome, everybody. It's my pleasure to welcome you here this afternoon. Thank you all for making it, despite the roads being so clear. So really appreciate that you can make it. It's my honor, actually, to speak to you after, now, how many years is it? Almost 9 years, I think, since Amit and I founded Africa Health Business. And this is our first impact report. We felt after 9 years, we should show what the impact has been of at least the last 5 years of our work. So it's a real pleasure to show. I always jokingly say AHB is my first baby. Yeah, founding AHB with Amit and not having any experience in running a business or growing a business, growing a team. It's really been a pleasure doing it together with him. And I always jokingly say Amit's always the front office, I'm the back office. So Amit makes sure that the message is out there, that people know AHB. But to make sure the work gets done in the back, that's me and the team. So I'm very happy to see you all here. And thanks to you also, AHB. As AHB, we are where we are today. And yeah, it's my pleasure again welcoming you. And before I announce Amit, we just want to share a bit of a brief video with a bit of a background about AHB and what drives us. So it's 5 minutes, so please bear with us, but I hope it's interesting.
Africa Health Business started in 2016 to really fulfill the relationship between public and private sector to improve the overall health in Africa.
We believe in Africa, by Africa, for Africa.
When we bring all partners and actors together and collaborate, we'll have a stronger, resilient, and a robust health system in Africa.
As we're advising the African continent how best to do that, we believe by using experts from the continent that have lived here, been born here, grown up here, and know firsthand and have experienced firsthand the healthcare systems on the continent.
One of the greatest milestones is a recognition that AHB started fulfilling a role that was not being carried out by anyone.
To me, it's the overall company growth that we've gone through. When we founded the company, I could have never imagined to being where we are today.
When we started engaging with African continental institutions like Africa CDC, WHO, and also ministries of health in each of the African states, it was very clear that we were a welcome entity that consolidates the views of the private sector and promotes a healthy partnership between the organizations.
One recent success story is a project or a program that we are running, which we ideated, initiated, implemented, and currently running. That's the Coalition for Women's Health in Africa. It's the first private sector driven and fully paid for coalition on the continent that only focuses on advancing the enabling environment for women's health in Africa.
The early challenges were pretty simple. We knew that the public sector didn't really clearly understand the role of the private sector, and the private sector didn't clearly understand what the public sector is doing. We needed to build trust. That was the most fundamental issue that we dealt with in the early days. And the way to build trust is to build a robust and a healthy dialogue.
That actually there is need for us to look at how can we collect the right data to inform policymakers and policy shapers, so we don't have this kind of thing because many countries don't have the data, therefore we make decisions based on the wrong data.
A lot of criticasters say the healthcare sector should not be having a for-profit component. It's bad to make money out of sick people. How we've overcome that is by sharing that for-profit doesn't mean for plunder. It means sustainability, it means moving away from donorship to ownership, it means economic empowerment, and the private health sector creates a lot of jobs that generate tax income, critical citizens that hopefully can also hold governments accountable to move to more transparent and sustainable systems in the public sector.
AHB has a long way to go. With the launch of this impact report we have, it clearly shows the journey we have been traveling since our inception, since 2016. Since a lot more needs to be done, AHB will continue driving deeper stakeholder engagements, bringing up the national priorities, and making sure that all partners are harmonized in their activities on health on the continent. So our work is cut out for us at Africa Health Business. The three pillars that remain critical and very important for us is quality, affordability, and equity. For 30 years, I've been in business in healthcare. I ran hospitals. As you know, I founded Avenue Healthcare, and you know that I've been part of the Momentum Health Insurance. I ran Africa Medical Investments. I built hospitals in at least 8 countries in Africa, Zimbabwe, Mozambique, and all that was during the business days of entrepreneurship. I realized one thing: whether you're multinational or you're an African corporate, what was really missing was a local African entity that could help you catalyze and consolidate the public-private trust and business. That was missing. There was a huge them and us scenario. Today I'm so proud. I'm sitting on a board of a state corporate reporting to Madam PS as the chair of Kenya Health Professions Oversight Authority. And we are an envy, to be honest. Kenya is an envy to so many African countries. They look at us. Even the Gen Z protests that you see out there is a source of envy that we can get messages across. But the public-private collaboration in Kenya has come a long way since I started Avenue in '95. It's come a long way. I think both parties get to know each other. I head the state corporate KHPOA. My CEO, Dr. Kioko, who was the Director of Medical Services, is also here, if you can talk to him. Through him and the board, we are able to forge just a small example of public-private partnership. But as I said, we've got a long way to go. This is just the beginning. Many of you have been involved in public-private engagements. You've been involved in public sector scaling of your businesses. You've been involved in trying to create a more stronger relationship between the public sector and ourselves. So we've been doing projects like these. If you see on the screen, 2 years ago in Kenya, we discussed women's health. And we realized women are going through some very uneven problems when comparing to gender in terms of health, and they suffer more of a health burden than men do. And the impact to them on livelihood and progress was becoming a little unfair. So we asked, What should we do as private sector? Guess what happened? Suddenly, within 6 months, Organon, Hologic and BD raised their hand in a forum like this and said, let's start making a difference in policy and shaping support for countries. We selected Ghana, Kenya, and South Africa, and we haven't looked back. Guess what happened afterwards? AstraZeneca team, who's here, Japaigo, who's here, Kaigen, Lasek, they all started joining us. Suddenly, we had a fully paid coalition of COHA that is helping ministries of health across the entire continent, making SRH products available, family planning available, changing policy, changing design, changing priorities. So COHA is just one example. What we did next is we went into blood. And Terumo is here, Roche is here, B Medical Systems, and so many companies came together and they said blood is a forgotten agenda. So we created a model called COBA, Coalition for Blood in Africa, that changes how blood is being seen as a forgotten component but started to save lives. You know Damusasa is here. I don't know if Aaron is here. Aaron, B Medical Systems. Is Terumo in the house? If Terumo is here, there. These are the kind of private sector movements that go beyond the boardroom. It's not only about share prices, Madam PS. It is also about going the extra mile and trying to make a difference. What we decided was we started becoming experts in project management. We've heard of the multinational companies that are based in Washington, D.C. We've heard of companies based in Japan. We've heard of companies based in Europe. But what about health consulting companies that are African-based, based in Africa, who employ Africans and design African solutions? That's what AHB is here for. Born and grown right here. What makes us really proud is it all started in Kenya. It started right here in front. We have nationals, you heard, we have Egyptians, we have people from Uganda, we have people from different countries. But what makes me most proud is we are based in Nairobi with so many consultants and health experts who learn health every day from experts like the ones you heard earlier, Mary, Malus, Caroline is here, who's our blood ambassador for Kenya, Madam PS. Let's recognize her. Caroline is the blood ambassador who's in Kenya who does, and so many experts here, Estee is here, and all these start letting the 30 people we work with here on a full-time basis do work across Africa, and 20 other consultants who are based outside Kenya. So with the team, I believe we are a true African company with Africa as our agenda. With partners like yourself, I think our work is cut out. We want to collaborate because collaboration is the new innovation. Thank you.
Good afternoon, everyone. Let me begin by saying, Honorable PS Mary Mutoni, there I will say reps from the various diplomatic missions and also as partner organizations, representatives of the private sector, members of the media, ladies and gentlemen. On behalf of the WHO representative, Dr. Abdou Diallo, who is out of the country, I'm Dr. Adiele Onyeze, representing the WHO. I'm a part of the WHO Regional Office for Africa, WHO Afro, multi-country assignment team, but we are based here in Nairobi. And from here, we support many other countries. So we are happy to be based here in Nairobi as well at the WHO country office. So on behalf of him, I would like to congratulate AHB for the successful launch that we're going to be having today of this African Health Business Impact Report. It's an honor to be addressing you as well today about the transformative initiative that stands here for us at the intersection of health systems and as well as global health issues and how they actually affect the economies and also the private sector. Beyond the pandemics, we are dealing with health issues that impact our economies daily. I believe you also have been experiencing this. For example, issues that deal with climate change, the increasing threat of antimicrobial resistance, persisting infectious diseases, which we all know, malaria, HIV, AIDS, and many of these other challenges. But they do not just affect individuals, they also have economic implications, especially for our private sector folks. WHO plays a vital role in addressing these health challenges, as you know, globally, including in Kenya, and of course, especially for the African region where we have our head office in Brazzaville, Congo. Now, we have a strategic plan which we call the Global Program of Work. The current that we are working on now or beginning to take effect is the Global GP. We call it the 14th Global Program of Work. So soon you will begin to hear a lot about this Global Program of Work 14. It is the agenda for WHO and aims to accelerate universal. Thank you. So it aims to accelerate universal health coverage, also global health security, so that any of the emergencies or maybe related pandemics or epidemics are quickly handled. Also to promote healthier populations. However, in achieving these goals, WHO requires sustainable, flexible, and predictable financing, which is where the WHO Health Investment Round comes in, aiming to transform the way the organization is funded and how we can ensure effectiveness in meeting our mandate. Now, as many of you have been wondering, especially for those in the private sector, what really is all of this, how is this going to benefit the private sector, and how do you engage with WHO? First, I would just want to state maybe 3 benefits quickly. One is, as you all know, there is the issue of corporate social responsibility, as well as the public image of your companies. From our experience, aligning these health initiatives with your company's private or let's say corporate social responsibility really can significantly enhance your profile in this regard. Companies that actively contribute to the well-being of communities gain positive public recognition and also build stronger reputations. So by supporting these WHO-related initiatives, of course, in support of the government, we are glad Madam PS is here. You actually demonstrate commitment to the health of the people, which can translate to increased customer loyalty as well as brand value. Secondly, economic stability and workforce health, which we all need. We have known from our data around the world that investing in health issues directly contribute to economic stability. A healthy workforce is crucial also for productivity as well as economic growth. In Kenya, we all know that improving health infrastructure services means fewer sick days, lower health care costs, as well as higher productivity amongst your workers, besides the issue of healthier communities as well. So all this will create a better environment for your business, so that this initiative is not, maybe just philanthropic, it's also good for business. Third, in respect to market expansion and innovation, supporting health initiatives opens actually new markets. So as we know, once the initiative take root, you actually have a bigger market in which to sell your products or in which to engage. And of course, that means higher revenue, possibly higher profits as well. So as health systems strengthen, communities also become more stable, prosperous, and also creating new business opportunities. So in all of this, you can see there's a lot of advantages for engaging with the health and also with global initiatives like those being established through WHO and, of course, our colleagues in the African region, including the Africa CDC. Now, beyond just economics, we also look at this in terms of strategic importance, which includes ensuring that we have health security. As we all know, with the COVID epidemic or pandemic, which is still not, it's not completely gone. Yeah. We have some increasing cases now, especially in Europe and America. As you all know, President Biden is also now down with COVID. So it's not gone. So, but WHO's work continues, as well as that of the government of Kenya through the Ministry of Health, to ensure that the country remains safe and does not go into another spiral of huge outbreak. So for us, the WHO investment case, which is also called All for Health and Health for All, clearly shows how WHO wants to make direct contribution to saving lives. Our estimate is that we are going to be saving not less than 40 million lives. We promote the health of at least 6 billion people and ensure at least 6 billion more benefit from universal health coverage. I want to assure you really that from our analysis and from the work we have been doing, every dollar invested in health goes a long way in fulfilling the promise to promote and provide health for all the citizens around the world. And the COVID pandemic experience has really shown us why it is important to ensure we also have equity in these issues. Besides that, just to indicate that we are close to the SDGs. 6 years from now, we should be attaining the 2030. So we do not have time. We need to accelerate. We need progress. We also need to make sure we have enhanced stakeholder engagements. Now, we are happy to know that, in advance of this initiative that WHO is putting in place, Brazil has agreed to host an investment round for the G20s at the G20 summit in Rio in November 2024, together with co-hosts, of course, from each WHO African region. For WHO Afro, the co-host is South Africa, and a high-level forum for WHO Investment Forum for African region will be held at a special event during the 74th WHO Regional Committee for Africa, taking place next month, 27th August in Brazzaville. So this is an important event that will coalesce all the efforts from all African regions, including Kenya. And we are very proud that AHB is a key partner of WHO Afro on this initiative. So ladies and gentlemen, I urge you as the leaders of the private sector and other key stakeholders to support the WHO investment round. And of course, to also support our key partner, AHB. Your contributions can make a significant difference really in improving health outcomes, both globally, of course, in Kenya as well, and also by providing financial support, resources, and innovation or innovative solutions. We can help not just WHO, but the government and the communities to achieve what we all strive for, which is health for all. So once again, I take this opportunity to thank AHB for organizing this launch event.
Thank you.
To explore also the possible areas in which we can, areas of convening the private sector to join hands with WHO, Africa CDC, the government, and others to support the citizens of Kenya. I encourage you all to commit to long-term engagement with our organization, as well as other health initiatives. For WHO, this is now made easier because we now have a framework which is called FENSA. It is the framework for the engagement of non-state actors. So under that framework, we can now engage with all private sector companies. I'm following some due diligence. We support your work. If it is you need help, for example, in securing approvals, pre-qualification, so you can market your products across boundaries, even in Africa or elsewhere. We are happy to work with you, with all our teams, both based in Kenya, Brazzaville, and also our experts based in Geneva, Switzerland. So in conclusion, just to say again, the WHO investment round represents a unique opportunity for you to make substantial impact in the health of people in Kenya and around the world. By supporting this initiative, you not only embrace the corporate social responsibility to increase your profile in that regard, but you also contribute to economic stability, innovation, as well as health security, which is important for all of us. Your involvement aligns with the SDGs and strengthens relationship with key stakeholders. So let us seize this opportunity as we discuss more today to work together towards a healthier, more stable, and prosperous future for all of us. I thank you again for your time and attention. I look forward to seeing you more actively participate in the various initiatives connected with AHB, the WHO, of course, my colleagues, Africa CDC, the ministry, as well as the upcoming investment round. Together, we can really make a great difference. I thank you.
So we're just teasing Dr. Onyeze, who was reading here without his glasses. The majority of us, it's the other way around, especially myself. But allow me to recognize the presence of our peers, Ms. Mary Mutoni. I'll try and pronounce, I hope I don't butcher your name, but I saw Muriuki. Muthoni? Okay. Thank you so much. And allow me to recognize Dr. Onyeze, who a few years back was actually my boss in Zambia. So it's really a pleasant surprise to meet you here, Dr. Onyeze. I also recognize the presence of the executive chairperson of the Africa Health Business, Dr. Amit. The managing director of Africa Health Business, who I'm told this would not have happened, the Africa Business Agenda, without her, Mrs. Malo Kibacha. The head of External Affairs, Dr. Danielle Munene, who's been very, very forthcoming, and thank you for the invitation to this beautiful place. Members of the press, distinguished ladies and gentlemen, good evening, everyone. I'm really, really pleased to be in this space, being the newest child on the block, and again, not by age, but, yeah, by assignment. It's really, really a pleasure. And Madam PS, It's nice that I'm meeting you in a more casual environment, but I look forward to coming to the office for a more detailed discussion around the agenda for the Africa CDC in this region. And we're grateful to Kenya for agreeing to host the Regional Coordinating Center. I do see that Kenya is a mother to many, many organizations, but I hope you will be your favorite as the Africa CDC. Africa Health Business, you're an amazing entity, and I'm glad that there is potential to collaborate further. I know that you're already in our space, but especially at the headquarter space, but we would like you more engaged with us here in the region. We are seated here, we're sitting on the same table, and so it's important that you help us carry our agenda here in Kenya, but also for the whole Eastern region. Some of you may not know, but in the Eastern region, according to the AU segregation of regions, we have 14 countries under the Eastern Africa region. And Kenya, of course, is the center of it all. But for the sake of those who may not know, we also have Comoros, we have Djibouti, we have Eritrea, Ethiopia, we have Madagascar, Mauritius, Rwanda, Seychelles, Somalia, Sudan, South Sudan, the United Republic of Tanzania, and Uganda. So, and I know that a lot of you are in all these spaces. So we're sitting in the same place, but also have our feet in many other places. And so pushing the agenda on collaboration and, of course, coordination. To actualize the goals on the continent for the Africa CDC, we align to various continental and, of course, global public health security agenda. Our push is on public health security. And if you listen to our history, the AU heads of states and government, after the Ebola outbreak that hit West Africa and killed millions of people and destroyed a lot of businesses, decided it was time for the continent to take responsibility over its health issues, its public health security. And so the heads of states and government sat together and said, guys, how are we going to do this? And the idea of the Africa CDC was born. And in 2016, like the Africa Health Business, we were established on the continent. And so the Africa CDC is an autonomous but health agency of the Africa Union. And so government is key and critical for us because of the agenda that we push and the power that they've given to us to push in terms of public health security. But we're happy that we have big brothers like WHO who have been on the global scene for a very long time. And through their experience, we're learning more on how to handle the continental agenda. So thank you, WHO. I'll just speak into some of the areas of focus aligned in our 2023-2027 strategic plan. And these include strengthening integrated health systems with the passion on the insistence to prevent and control the high burden of disease on the continent. We see a lot of emerging and re-emerging infections or diseases surrounded by different factors, including inadequate healthcare systems, but also the issues of climate change and so on and so forth. And so I think a wide sector representation is key and important for us all to move this public health security agenda in a multi-sectoral manner. But we also push on surveillance and early warning systems to be able to determine in good time what is happening around us. We've done our risk assessments, but we get surprised the way we're surprised by the COVID-19. We all thought we would be able to manage the next epidemic or pandemic, but COVID-19 evidently showed that, we are in an inadequate space regarding health systems. And so epidemic preparedness and response becomes a key and critical area of focus. And again, I know that there are a lot of people, a lot of players in this agenda, but in a collaborative manner, we want to work together. While the Ministry of Health is the key and most important component of the healthcare agenda, we also have recognized that it is important to have this strategic entity that is mandated to look at public health security specifically. And that's why the Africa CDC, working with the governments and their ministries of health, are pushing an agenda to have national public health institutes. And I'm happy that Kenya is a good example already. Thank you so much, Madam PS. Ladies and gentlemen, I've spoken generally about what's been happening on the Africa CDC agenda, but allow me to just speak into about 4 functions that the regional coordinating centers are responsible for. And the main agenda is for us to be able to operationalize the agenda of the Africa CDC in the regional setup. And so we have 5 regional coordinating centers. The Eastern hub being in Kenya, we have Egypt holding the northern RCC, we have Nigeria for West Africa, we have Gabon for Central Africa, we have Zambia, where I come from, hosting the Southern Africa entity. So among the functions, apart from implementing or operationalizing the Africa CDC agenda, we also push the agenda on coordination and collaboration and integration among the different member states in our regions, with the regional economic communities, and of course all the public health sectors, including the private sector that is here with us today. We also push the agenda on mapping, strengthening, and networking for public health assets in order to harness the existing capacities and capabilities as we together advance the public health agenda. Knowledge exchange becomes critical. What happens in Southern Africa probably also happens here. But the way it's responded to in Southern Africa is different from here. There are issues of culture, there are issues of environment, and the different players on the ground. And so exchanging this information is good for us. And I think we learned through the COVID-19 that learning lessons from other places or other regions or other players helped improve how we responded to the outbreak. And today we are still standing, hit, but still alive, after the COVID-19. Allow me to also speak about the new public health order for the Africa CDC. This was launched in 2021, and really the idea is to reinforce the importance of regional health security mechanisms put to address global health issues in an agile and contextualized manner. In this space, we emphasize collaboration based on inclusivity, mutual respect, and mutual benefits for all. So as the Africa CDC, we seek to create synergies in common priority areas, and I'm happy that even before I came to the fore, as we networked, we seem to all have similar priority areas. Looking at the shared goals, setting clear commitments, and investment for all partners, shared decision making, and contributing to creating lasting and meaningful impact at all levels of action. We are also pushing an agenda that promotes a more holistic approach to development and better governance. As multi-stakeholder partners, the Africa CDC, pushes to allow, with unique complementary efforts, or what you'd call core competencies, to add value to the development efforts and pool their resources and assets for solving problems, the public sector and the private sector. The Africa CDC envisions private sector contributions to its strategic objectives, and it also gives charge to the private sector, who are represented in this room, to be a trusted and action-oriented supporter of governments and the Africa CDC in furthering our public health agenda. We indeed strive to work with the partners in this space in ensuring health security on the continent by various joint efforts with several partners, including the Africa Health Business and the other partners who are represented here. In this region, we're currently carrying out a partner mapping exercise for the Eastern region, and our agenda is to push joint areas of collaboration with the partners. And I'm happy that Dr. Amit, earlier on, we did talk about getting to that round table where we can meet the important stakeholders for this matter. So I'm really excited that we are speaking the same language. So before I end my remarks, I wish to take this opportunity to welcome all of you here to one of our biggest roundtable meetings, the Conference for Public Health in Africa. And this year it will be held in Morocco, so we're looking forward to having all of you here. The Africa Health Business in the 2023 meeting was very instrumental in pushing a lot of our meetings, supporting us with resources, including human resource, in terms of speakers and so on and so forth. And so we look forward to that continued engagement even this time. I don't remember a lot of you because at that time, I'm sure you saw me, I was always in sneakers because I was the co-chair of the secretariat and had to do the running around. But I'm so glad for those who came, and I'm very sure that Morocco would just be as exciting. Yeah. So, Madam PS, thank you very much for according us the opportunity to meet with these wonderful partners, and we look forward to continued collaboration under your coordinated guidance. Thank you very much.
Ladies and gentlemen, good evening. Good evening once more. I'm very happy to be here, and thank you, Chair, for inviting me. When I come here, I am your subject because you can give me marching orders from the private sector. When you come to the ministry, you are under me because I can give you marching orders. And that is life. So the government, through the Ministry of Health, is very much dedicated in achieving the Sustainable Development Goal 3C, which focuses on universal health coverage and to ensure healthy lives and promote well-being for all people of all ages. And in the recent past, ladies and gentlemen, you have been able to see the strive that we have pushed to even have laws, 4 acts within 6 months, just to ensure that we streamline everything. The Digital Health Act of 2023, the Social Health Insurance Act of 2023, the Facility Improvement Act of 2023, and the Primary Health Care Act of 2023. And this is by providing access, safe, affordable vaccinations, strengthen health systems, foster resilience in the face of health adversities. And we have many. We are in the health sector, so we know this is a social sector. It is one that you will find in most circumstances is underfunded, but you will find that the demand is so high. In line with this goal, we are very much dedicated to partnerships aimed at improving the quality of life for all Kenyans by ensuring available, accessible, acceptable, and affordable quality healthcare. We must provide that to all of us, to any of us, and in line with what has already been stipulated by other institutions, the WHO, Africa CDC, And our commitment to UHC is driven by the urgent need to address the major health challenges facing our population and ensuring that Kenyans have access to the healthcare services they need without suffering the financial burden. Remember, everybody needs the quality healthcare, but is it accessible to you? Is it available at the time of need when you have an emergency, when you're rushed to a private hospital, a public hospital, do you get attended to? So is it available? Is it accessible? The infrastructure. You know, when we go to hospital, to the health facilities, and we find open maternity wards where the women are just screaming and they are in the open. Where is the decency? We are steadfast in our mission at the ministry to provide primary health care that is comprehensive, community-based, and that focuses on preventive and promotive, curative and rehabilitative services, starting from the provision of the level 1 services by the community health promoter. His Excellency the President, Dr. William Samoei Ruto, has already commissioned 107 community health promoters. By the way, I'm correcting you. You said 100,000. I am adding you 7,000. So it is 107,000 community health promoters in the country. And they are spread across. Every morning I open my dashboard and I'm able to see how many people have been seen by the community health promoter on a daily basis. I can print that to you, and you can also use it for policy decision making. As WHO, as Africa CDC, you don't have to reinvent the wheel. Partner with us, and let's make this happen. And we have KHPOA to partner with. They are the prefects of the regulators. So you need them. You need them to pull together those small regulators so that they can tell you where the clinical officers are, where the nurses are, where the doctors are. And then we have the data from the community health promoters. It is right from the household. This commitment, in line with the principles of the Alma-Ata Declaration of 1978, which emphasizes on the importance of primary health care as the cornerstone of the robust health system, calling for urgent action by all governments, health and development workers, and the world community to protect, promote the health of our people. Even our constitution gives privilege and mandatory look into providing quality health care to all Kenyans, whether you are an immigrant or a Kenyan. So you go to any hospital, you have the right to access quality health care. So partnership is not an option here. I mean, it's not an afterthought, but it is a mandatory option that we have to come together and work for the benefit of all of us. And to achieve this, we have charted a clear roadmap towards achieving universal health coverage, where multiple stakeholders, including private sector, play a very, very crucial role. And government again recognizes the vital role that the private sector plays in the health landscape, as the past several years of our collaboration have led to robust growth in the health sector. I come from the private sector, yes. So I totally understand what needs to be done to collaborate. And the one thing I'll challenge you from the private sector, we don't know what the government does. Mm-hmm. But if the mountain doesn't come to you, you must go to it. So if the private sector doesn't know what they do, yet they are the one running the economy, the government must go to the private sector. So I'm happy that I know I can run to you. Yes. I can go to everybody else in this room. And we can make a pact like never before. Because the government cannot run alone. Mm-hmm. Trust you me. We need the development partners. We need the financial institutions. We need the private sector like never before. And especially now when they are emerging and re-emerging public health activities across board. Africa CDC has simply just mentioned but a few. The new public health order. So do we all understand? And for your information, Africa CDC and WHO are both my children. So they have sibling rivalry. But I'm holding them like twins. I am holding them close to my chest because we must set up the WHO hub, and we must ensure that Africa CDC is equally catered for. And we have already given them an office.
Yes, well done.
So one will be on this side of the breast and the other one on this side. So the private sector is an essential partner in our journey towards universal health coverage. And according to the Facility Census of 2023 report, by the way, the Ministry of Health has a very comprehensive report, which I'm ashamed that maybe we have not gotten a copy of it. We have done an assessment of all the levels, the facilities in this country, the 14,000 of them, both private, public, and faith-based. There are 14,000. That book, whether you're in the private sector, in the public sector, or faith-based, you will be able to use that data to make very critical decisions. If you need to manufacture a drug, please look for that book. If you want to thrive in Kenya, look for that book. And Dr. Keoko is here, so I am instructing, directing, that he is the one to make sure the people here get a copy of our health census for 2023 December. Because it has a lot of information that will help each one of you. So, according to the census report, private sector comprises of 46% of the health facilities, bringing innovation, efficiency, and additional resources that complement public health efforts. And this collaboration approach ensures that we can extend health facilities to even the most remote and undeserved communities, thereby leaving no one behind. We are talking about digitization. We are talking about innovation, efficiency. The community health promoter of today has a digital gadget where they record information. That's how I'm able to see who went to whose home at a glance of my dashboard. That information will help me today and in future. So again, this we have been able to translate even into a book. We have been able to translate even into a physical assessment of the health facilities. Therefore, the collaboration, by working together, we have enhanced the delivery of health services and improved the patient's outcome. Look at the Digital Health Act. And I keep saying this story because it is the truth. Where I grew up, in one of the villages, we were many in our family. My mother had one big box where she used to keep exercise books. And those exercise books bore each one's name. So I had mine, which was written Mary Modoni. Every time I got ill, you pick yours and you're taken to the health facility. But they would get lost at some point. So the Digital Health Act comes in to bridge those gaps. That when you go to, you're referred to any other health facility from the level 2, level 3. By the time you get to Kenyatta, where there is the specialized care, then they already know what you were prescribed for from the word go. They would go making mistakes left, right, and center. The highest mortality rate is misdiagnosis in this country. Trust you me, we can clear that by ensuring we have the right equipment, the right human resource, the right infrastructure to take care of every patient in this country. Therefore, on this part, the ministry will continue providing an enabling environment for the private sector. Because we do not want somebody has set up a clinic and you have about 30 people coming to inspect the clinic and asking you to pay levy for the same. It has to stop. Really, it has to stop. We have to streamline and provide enabling environment for the private sector so that they are able to serve the citizens. Otherwise, we cannot talk about affordability on one hand, and on the other hand, we are doing the opposite. Furthermore, the ministry is ready to open to partnerships and collaborations with the private sector, both within Africa and from the international arena. We are open. We are planting trees because climate change cuts across. It doesn't know the private sector or public. There's no patient for the private sector and public. A patient is a patient. So why don't we join hands? Most of the diseases that we have today is out of climate change issues. The extreme weather conditions, from extreme heat to more rainfall in our areas, where malaria prevalence increases every now and then when it rains, when there's heat. You see? Preventable diseases like diarrhea, preventable diseases like respiratory diseases, So we are ready to work together from Africa, within and outside the international arena. And we understand that achieving our health goals requires a collective action and shared responsibility. Daktari, that is why we are here today.
Thank you.
For this shared responsibility. The impact report that we launched today is our shared responsibility. We go all out and implement together. You can't do it alone. By fostering these partnerships, we can leverage on global expertise, technology, best practices, enhance our health systems to a better level. And this is in line with the Social Development Goal 17, partnerships. Partnerships, partnerships, partnerships. You don't have to reinvent the wheel. When somebody else has done it, incorporate them, whether it is in the private sector. Pull the public sector in your company. Let's bring the expertise that we have. Bring your expertise that you have so that we move together. So collaboration, collaboration, collaboration. And today, we want to congratulate the Africa Health Business for the release of their impact report, which highlights the pivotal role the private sector is playing in advancing and enhancing healthcare across the continent. This report, Daktari, underscores the need for more purposeful and impactful partnerships that will drive and strengthen health agenda in Africa. It is a testament to what can be achieved when different stakeholders in health come together with a common goal. I kept looking at the companies you're placing on the wall, and I'm like, where have I been? Why am I not part of it? There's power in the numbers. So next time I want to see MOH. Ministry of Health. Being part and parcel of some impact. There is nothing that works without impact, sustainability, and of course visibility of it. That's why we are here. Because we really need to also speak to the people that this is what we are doing. We've already impacted, yes. Maybe the community health promoters are in the field, they've registered 7 million people, 7 million households. That translates to about times 5, 25, 30 million people. They have assessed and they have referred about 77,000 people for diabetes. It's impact. They have referred, another 180 people for other ailments. They are looking into children under 5 for malnutrition issues. Having checked about 100 and something women who are pregnant and referred them for antenatal clinic. It's impact.
Absolutely.
But who knows about it?
Let's write it. Yes, write it. 1 year down the road.
Who has written the story? Who is it impacting? Who is it influencing? Because in health, we got to look for the people to influence. It's social sector. We are a social being. We are a society. We live in a needs community. So we live in a space where we must reach out to each other and join hands if we have to succeed. Ladies and gentlemen, the Ministry of Health is very keen to work with AHB and other stakeholders present here today. We are already working with some of them, and we want to improve the healthcare across Kenya. The other day, I challenged Chair, the CEO, and other of my agencies, and I told them, get involved in what you even think does not involve you. What you think that I'm not the director in charge, please get involved and see how it can help you in your own space, because we are interlinked into one. Let us continue building on our collaborations, innovate, strive for excellence and the healthcare delivery. Thank you, good people. Enjoy your evening.